neglect.
Thank you. And again, welcome to all of you and welcome to those of you on the webcast. The research findings of the last 20 years have really made it very, very clear that abuse and neglect affect all aspects of child development. Everything from brain development, which is a relatively new area that we're studying, to physical development, to cognitive development, social development, mental health, everything is affected by abuse and neglect. The effects are different in different developmental periods, but the effects also appear to cascade, to become more problematic over time. In infancy, some of the problems that we see are problems with attachments and self-regulatory issues. In childhood, problems are seen in internalizing problems such as anxiety and depression, and externalizing symptoms such as acting out, among other things. And then in adulthood, again, across all domains, but for example, in arrest, substance abuse, anxiety, depression, and so forth. But despite these problematic effects, individual differences are seen. Some children fare better than other children. This phenomenon of some children faring much better than others is referred to as the study of resilience. And a number of factors have been identified as important to resilience, including things like experiencing abuse and neglect for less severe or less chronic abuse and neglect, or having a very supportive figure, somebody that can be there with you through these difficult times that can help you work through those things. So next steps involve disentangling the effects of abuse and neglect from other challenging conditions. This is very difficult to do because all of our work is correlational by necessity, but this is an important next step. And enhancing what we know about how neurobiological, behavioral, and environmental factors mediate the effects of abuse and neglect in terms of later outcomes. Now, the report emphasized that although effects of abuse and neglect are pernicious and affect all domains of functioning, change is possible. This is not static. The child is not necessarily scarred forever. Children's developmental trajectories can change. And it's this hopeful message that makes it important as we think about interventions and treatment possibilities. So it's especially important that in the last 20 years, intervention programs have developed that have strong evidence base. And this is one of the most impressive developments of the last 20 years. Some programs have been developed that are preventive, that intervene before with high-risk families, high-risk children before abuse and neglect are seen, and some when the child has experienced or the family has already been identified as abusing or neglecting. And this is a very impressive literature that, am I too close? Oh. A very impressive literature that indicates the, can you tell me what it says?
It's likely due to a cell phone turned on stage.
Cell phone turned on stage? Okay. I think there's feedback. Thank you. So the treatment programs that are both preventative and treatment oriented once the problems have already been identified. And this is just a very exciting development for the field. So we've got these evidence-based programs, but now the problem is that many of the children who have experienced abuse and neglect or who are at risk for abuse and neglect aren't receiving these evidence-based programs. And this is not a problem that is unique to our field. This is a real critical and challenging problem for every field of science that has interventions. And that is, once you develop an evidence-based program, getting it out into the field. There is a field of study that is known as dissemination and implementation that involves studying how to take interventions out into communities It's very challenging, but clearly just a critical next step and a key recommendation that we have. So implementing in communities, taking interventions to scale, and sustaining interventions over time. So we have both very exciting news with respect to interventions, but also very important next steps. Now passing it